In this video, we're talking about the top 10 most dangerous viruses in the world. Whether you're in the office, on vacation, or just trying to have a normal day, odds are you've been affected by a virus at some point. Some viruses, like the common cold, are mild and easily treated with over-the-counter medication. Other viruses can be deadly. Take a look at the 10 deadliest viruses in the world and how to protect yourself from them. The first virus on our list is the coronavirus. The COVID-19 pandemic, also known as the coronavirus pandemic, is an ongoing pandemic of coronavirus disease of 2019. The coronavirus is the top most recent deadly virus in the world, including 6,812,798 deaths. It destroyed almost half of the world's population. In 2019, a new coronavirus was identified as the cause of a disease outbreak that originated in China. Out of the 79 viruses that have killed over 1 million people, coronavirus is responsible for almost 60% of those deaths. The virus causes severe respiratory illness and often results in pneumonia, which can be fatal. It has also been linked to several other serious diseases, including severe acute respiratory syndrome and Middle East respiratory syndrome. There's a recently launched vaccine for coronavirus with booster doses. Next on our list is Rotavirus. Rotavirus is a highly contagious virus that can cause severe vomiting and diarrhea in infants and children. The virus is most commonly spread through contact with fecal material, such as saliva or vomit. It can also be spread through contact with contaminated surfaces, such as door handles or countertops. There's no specific cure for rotavirus infection, but treatment focuses on relieving symptoms. Early diagnosis and treatment are important to prevent extensive damage to the gut bacteria, which are crucial for the absorption of nutrients. Prevention of rotavirus infection is primarily through good hygiene practices, including hand washing after using the bathroom and before touching surfaces that may be contaminated. Thirdly, we have Rabies virus, which infects both humans as well as animals, primarily through bites from a rabid animal, resulting in inflammation and swelling within 2 to 10 days post-exposure, along with symptoms including fever and anxiety till death ultimately occurs, unless a proper vaccination program is undertaken immediately after being exposed to rabies infection, especially via bites from animals. Its fatality rate stands at nearly 99%. For those who don't receive timely treatment or vaccination against this dreadful disease, though fortunately success rates for recovery stand at nearly 100% when adequate care is provided soon enough. So watch out if you ever come across any stray animals exhibiting signs associated with rabies infection. Continuing further down the list, we have the Marburg virus. Marburg virus is a severe and deadly virus that can cause hemorrhagic fever. It was first discovered in 1967 in Marburg, Germany, and has since caused several outbreaks throughout Africa and Europe. There have been no recorded cases in the United States, but the virus is believed to be circulating there. Symptoms of Marburg virus infection include fever, muscle aches, vomiting, diarrhea, and seizures. In extreme cases, the virus can lead to bleeding inside the brain and death. There's no specific treatment for Marburg virus infections, but supportive care such as hydration and oxygen therapy can help reduce symptoms. Next on our list is the Smallpox virus, which causes high fevers, headaches, and rashes all over the body in its initial stages before eventually leading to death if left untreated or when treatment fails due to severe complications arising out of it, such as organ failure, etc. It is believed that smallpox killed an estimated 300 million people since 1950 before it was officially declared eradicated by the WHO in 1979 after global immunization campaigns were launched against it, making it one of humanity's greatest successes against deadly diseases. Moving on to number 6, we have dengue. Dengue is a mosquito-borne virus that can cause severe symptoms including fever, rash, and joint pain. There is no specific cure for dengue, but the virus can be prevented with preventative measures such as using insect repellent and staying indoors during peak hours when mosquitoes are most active. Dengue has been reported in over 100 countries, and it's a major concern globally due to its high mortality rate. At number 7, the deadliest virus is Ebola. Ebola is a virus that can cause severe illnesses and even death in humans. It is a member of the family of viruses that includes the common cold and SARS, or severe acute respiratory syndrome. Ebola is the most commonly spread through contact with blood, body fluids, or saliva from an infected person. It can also be spread through contact with objects or surfaces that have been contaminated with the virus. Ebola can cause serious illness in any stage of development, but it is most dangerous to people who are already sick or who have recently been sick. The symptoms of Ebola include fever, muscle pain, headache, vomiting, diarrhea, and body weakness. In some cases, individuals may also experience bleeding from the eyes and ears. There is no specific treatment for Ebola. However, treatment focuses on providing comfort to patients and ensuring their safety. The next one is the Lassa virus. Lassa virus is a hemorrhagic fever virus that causes severe disease in humans. It is one of the most deadly viruses in the world. It has killed hundreds of people since it was first identified in 1977. Lassa virus is found in Africa and the Middle East and can be spread through contact with blood, body fluids, or tissue from an infected person. The virus can also be spread through contact with objects or surfaces that have been contaminated with the virus. There is no specific treatment for Lassa virus infection, and patients usually die from the disease within a few days after contracting it. The ninth place on our list goes to influenza. Influenza is a highly contagious respiratory illness caused by the influenza virus. It can cause mild to severe symptoms, including fever, headache, and body aches. In severe cases, it can lead to pneumonia, which is a serious lung infection. There is no specific treatment for influenza, but people can take steps to protect themselves from the virus. The best way to prevent influenza is to get vaccinated against it. The Centers for Disease Control and Prevention, or CDC, recommends annually having the flu vaccine for everyone 6 months and older. The last one on our list is the Hantavirus. The Hantavirus is one of the deadliest viruses in the world. It is a respiratory virus that can cause severe respiratory illness, including pneumonia and even death. There is no known cure for hantavirus disease, and it is highly contagious. Anyone who contracts hantavirus should seek immediate medical attention. We hope you guys surely liked and enjoyed our video. Make sure to subscribe to our YouTube channel and hit the bell icon for upcoming videos. Thanks for watching. Have a wonderful day and take care of yourselves.